and I've been asked to give you a little background on periodontal disease and what the disease is that we're trying to treat. Give you a little background on the product Emdogain, which is used to regenerate the tissues that are lost during periodontal disease. And I will do that for 15 or 20 minutes, and then I will turn it over to Dr. Struan to give you some clinical cases and show you some of how we use these in our patients' mouths. So what I'd like to do is just give you a quick background on the disease that we deal with in our patients, then talk about and contrast repair versus regeneration, which is sort of what used to happen in the old days and what's happening now in the new days with Emdogain. Then talk about what Emdogain is, which is what enamel matrix derivative is, and then talk about how we use and do regeneration around teeth to grow the tissues back that have been lost. And then I'll just summarize that for you. So when we talk about periodontal disease, there are two major forms of periodontal disease. There's gingivitis, which means redness of your gums, and then there's periodontitis. And the difference is that in periodontitis, you lose the attachment to the teeth of the tissues that are holding your teeth in your mouth. So periodontitis is the more important form of the disease because you're losing the structures that hold your teeth in your mouth. It turns out that periodontal disease or periodontitis can come in, you can see it as slight amounts or moderate amounts or more severe amounts, and probably 3 out of 4 adults have some degree of periodontal disease. In other words, we've lost some of the attachment holding the teeth in the mouth, and that's what periodontitis is. About 5 to 20%, or 5 to 20 out of 100, are going to have severe periodontal problems where they're going to have a loss of significant amounts of tissue around their teeth, and your teeth are going to get loose. If you don't treat this disease, then the teeth eventually will fall out of your mouth. They will actually come out, be extracted from your mouth. As it turns out also then, severe periodontitis or severe forms of this disease are the major reason for bone loss around the world, or tooth loss around the world. So periodontal disease is a disease that older people deal with, and it causes you to lose your teeth if it's not treated. We treat it a number of different ways, predominantly either non-surgically, which means we clean your teeth real well and we do it frequently, or we can do it surgically. And if we want to try to regrow those lost tissues with Emdogain, we have to do a surgical procedure to regrow the tissues that have been lost to this disease. This is a picture of a tooth that will give you an idea of what a healthy tooth looks like. And if you focus on this left side here, this is the crown of the tooth, and this is the root of the tooth. This is the bone around your tooth, and then there's a ligament, a suspensory ligament that extends from the root surface out to the bone. And that's when you bite down, it kind of suspends and allows the tooth to move. And this is a collagen ligament, periodontal ligament. And then the ligament is attached to the surface of the root with a very thin layer of what's called cementum. And then there's the periodontal ligament bone. So when we talk about the tissues of the periodontal ligament, we're talking about the cementum on the root, the ligament, the collagen ligament fiber, and then the bone tissue. And what happens in periodontal disease is people let plaque, bacterial plaque, accumulate around the tops of their teeth and right in the little neck of the tissue around the tooth. If that sits in there for a very long period of time, your body reacts by creating inflammation and it gets red. If that plaque stays around a long time, it calcifies and becomes calculus. And then what happens is the bone, this bone right here, starts melting away, and you can see in this area the bone has melted away and the tissues are very inflamed here. So what we try to do with the Emdogain product is we try to regrow this bone in here. And this is called regeneration. If we can regrow the cementum, the periodontal ligament, and the bone tissue. So the goal for us, certainly, to treat a patient with periodontal disease is to try to clean the teeth and try to regrow this, and this is what Emdogain allows us to do. I should distinguish between repair and regeneration, because this is very important for us and for you as a patient. When you have bone loss, and the bone used to be in this area here, here's the bacterial plaque that's caused inflammation, and that inflammation has caused the bone to go away, so this tooth now is missing attachment, so it's not going to be as strong as the other teeth. If we just simply clean this out, if we just clean the plaque and calculus off of the side of the root, we generally get repair, which is not the true attachment to the tooth. So this is not a desirable outcome, but if you only clean the teeth, this is what's going to happen. If we add the Emdogain product after we clean this out, then we get the bone to regrow, and then we get what we call a functional attachment, so this tooth is held back in place by the tissues that we started with. And that's what we would like to do for our patients, is to regrow or regenerate the cementum, periodontal ligament, and bone. And that's where the Emdogain product comes into play. Now, this is probably not something you want to see after breakfast this morning, but this is a tooth. This is a lower first molar, a 6-year molar, what we call a 6-year molar tooth, lower first molar. And you can see there's a defect around this tooth. The bone should be like this one here, but you can see we're missing a lot of the bone tissue here. So the root is exposed. And so what we would like to do for our patients here is to regrow this bone tissue and the periodontal ligament and the cementum. And so this is the problem that our patients present with. And this is a very prevalent problem. So what we try to do is we clean this area, we add the Emdogain to it, and this Emdogain material helps us regrow cementum along the surface here. It's actually all along the surface. And then it helps us to regrow the missing bone tissue in here as well. And that's the goal with this Emdogain product. Now, what is Emdogain? Emdogain is actually a mixture of proteins that have been isolated from a tooth, the top of a tooth, the crown of a tooth. If you take a crown of a tooth and you dissolve it and look at the proteins that make that up, those are called enamel matrix derived proteins. It's a mixture of proteins that come from our own bodies. And what Straumann has done is isolated these proteins and used these and added those with a carrier material, the carrier, because you can't add the proteins by themselves. So you put the proteins in the carrier, and then we use this to inject around the tooth, and these proteins stimulate the tissues to regrow. So if you look at what's been known about this material's been on the market for some time now, and the details aren't important here except that it's a well-investigated material, and it does a lot of very positive things to regrow these tissues. So Emdogain is a very well-studied material. It's composed of these proteins that kind of form little balls, and these are hydrophobic, means they don't like water, and they will sit down around the tooth. So what we do with this material is we can either use it alone around the tooth, or we can take a bone graft material, especially for a defect that's very large. We like to support the blood clot and support the wound healing in that area. You can add the Emdogain product to any type of bone graft material that you like to use as a clinician, and then put that around the tooth to stimulate the tissues to regrow. And so that helps the bone graft, and the Emdogain will help regenerate these tissues. Now, what actually happens in the very bottom of that defect, this is the bony defect, this is the bone tissue out here, this is the root surface, and this is where some of the cementum is on the root. What actually happens when we put the Emdogain in here is it lays down along the surface of the tooth and along the bone, and it recruits the cells of our bodies to come in and start forming new tissue. So what it does is it helps the cells of our body come in and reform these tissues, the cementum, the ligament, and then bone tissue. And that's what these proteins do. They stimulate our bodies to regrow the tissues that you lost. So if you look at over a period of months to years, we see this is the cementum along here, the periodontal ligament in the diagram form, and then the bone tissue. And then as this material fills in, we get a regrowth of new bone, ligament, and cementum. And that's what this Emdogain product does for us. This is an example of an experiment I did in some baboons. This is the side of the root here. We had created a defect around that tooth, and we put Emdogain in here alone. I put a little notch in the root down at the bottom of the defect, and you can see here this cementum material actually grows into the notch and grows way up here, and then there's a area for the periodontal ligament, and then this is all new bone formation along here. So we've been able to take a defect that was down into this area and regrow the cementum, ligament, and bone all the way up the root surface here. So we're very excited that this material can do that. We also can mix it with a bone graft. So this is another tooth in another baboon. We had a defect that was in this area here. I added the Emdogain product into the defect, and then I took some bone chips from the jaw of this baboon and added more Emdogain to it, and we filled the whole defect, that missing area where there was a defect. And if you look at this, again, here's the root surface, here's the notch, which means I removed all of this bone and ligament and cementum, and then we added the bone graft and the Emdogain, and we see new cementum again going all the way up here. We see the periodontal ligament space here, and then this lighter pink is all new bone formation in here. This darker pink is the old bone, and so you can see that we have new bone, periodontal ligament, and cementum, which is what we call regeneration. And you have to show that histologically to show that you truly regenerate these tissues around the teeth. I'll just tell you that Emdogain, we've done some recent research looking at Emdogain not only as the whole complex of proteins, but working with the Straumann Institute, we've been able to separate some of the proteins from each other, and we have different fractions of these. And in this experiment, we were looking at bone formation with Emdogain and its fragments. And what was very interesting was that the Emdogain product was just as effective as another growth factor that only grows bone. So the Emdogain was as good as, actually slightly better than this other bone-producing growth factor called bone morphogenetic protein. So the Emdogain is an outstanding product to not only grow periodontal ligament, but it can also stimulate bone in these experimental conditions. Interestingly, when we separated the proteins, none of them had as much activity as the native material, the unfractionated material. So we're very excited about understanding the components of Emdogain and how that works to stimulate regeneration. So let me just summarize this part and just say that this is a very evidence-based product. It's been around a long time. There are a lot of publications that document the ability of this material to regrow the tissues around our teeth. Many patients have been treated, and Dr. Schoulian is going to show you some outstanding cases, the way this looks on x-rays and in people's mouths. And what this material does is it fills those defects around the teeth about to 60 to 70%. So we can regrow, rather than lose your tooth, we can regrow these tissues so you can keep your teeth for a longer period of time. And we measure that with some measurements called attachment levels when we look around your teeth, and we can show that you regrow the tissues around these teeth. So in summary, Straumann mimics in a unique way the periodontal development, enabling the regeneration of the ligament, the cementum, and the bone. And it turns out that these proteins that we isolate, are actually the same proteins that were there when your tooth developed originally. So as you were growing up as a baby and your teeth were forming, these enamel proteins actually stimulated this whole attachment apparatus, the cementum, ligament, and bone, natively. And that's what happens early on in our lives. So what we're doing is simply taking those same proteins and adding them back and using them later on. So we're really mimicking the early development in our bodies. This material results in what we call a functional attachment, which means that the tooth is held into the socket the same way it was before you lost those tissues. So that's really nice that we can bring these tissues back and it functions exactly the same way as it did before you lost these tissues. And this is not an easy type of process to do, but the Emdogain, very simple to apply. Dr. Schoulian is going to show you how we use it in the clinic. It's very simple to use. It precipitates right into that defect, and it allows this tissue to regenerate. The other thing that we do when we have very large defects, we like to add some sort of bone grafting materials. We've sort of used those over the years to try to regrow these tissues. They've never been as effective as we'd like, but if we add Emdogain plus the bone graft, we get a much better result. And so the bone grafting materials give us stability of this and helps this regenerate. So with that, let me turn it over to Dr. Schoulian, and he's going to show you some more cases.